my name is Laura Sandquist. I am an adult and geriatric nurse practitioner, and I have a doctorate of nursing practice from the University of Minnesota in Integrative Health and Healing. And I'm from Minneapolis, Minnesota, and I work at Touchstone's Community Health and Wellness Center. After nursing school, I worked at Abbott Northwestern Hospital in Minneapolis. And as I was starting there as a nurse, they were just launching the Transformative Nurse Training Program. And so I was able to learn about all these different integrative therapies. And at the same time, my husband was starting chiropractic school. And so as he was learning more about chiropractic, and I was being exposed to these different integrative therapies and the Penny George Institute for Health and Healing, everything just seemed to resonate with me. That was more integrative and holistic. So when I think about how I practice at Touchstone's Community Health and Wellness Center, I think of integrating, three philosophies. It's looking at holistic health, integrative nursing, and functional medicine, and really taking the three of those philosophies and combining them into one approach. My job is to gather the client's story and really deeply listen to what's going on. And instead of really breaking their body up into different systems, like today we're just going to talk about your digestion or just your headaches, it's really looking at how does that all play together and how does that impact or interact with 8 areas of wellness. So things like nutrition, their sleep, their stress, the environment that they're in, the relationships that they have, their spirituality, and their connection to their own purpose. And then together with the patient, we partner together to develop a wellness plan. And that's what we'll work on moving forward to bring them to the next level of feeling well. Yeah, I can think of one client in particular that really stands out. She was a woman, 55 years old. She presented with about 14 diagnoses, the typical things like high blood pressure, obesity, congestive heart failure, type 2 diabetes with a hemoglobin A1C of 10. And she came in just feeling hopeless, and that, her doctor had said, I've kind of done what I can for you, and here's another medication was always the answer. And so when a client works through a wellness plan with us, typically they are seeing the entire team. And what we saw with this woman in 7 months was her hemoglobin A1C down to 7.9 from 10, and after a year down to 6.6. She also lost about 11.5 pounds and maintained that weight loss. But I think more importantly, she was a completely different person. She was empowered. She felt happy. She had found some purpose in taking care of her grandkids. And I think that's what's important for me, is just helping people shift their level of awareness and their level of awareness of what's possible. What we did was really just teach her and gave her the tools so now she can do it herself. And then that awareness that there are other ways besides pills.